So today's video is going to be taking a closer look at the skull. The skull is the most complex bony structure of our skeleton. Believe it or not, between your head or cranium and then your face, there are 22 total bones. And all of those bones have grown together and are united by joints. But these joints don't move like some of the other joints in our bodies. These joints are immovable joints that we call sutures. And when you look at the skull, you'll see these little serrated, almost looks like a sawtooth or jagged lines. And those jagged lines are the suture lines that unite the different bones of the skull into its bony structure. A lot of the sutures are named for the bones that they connect. So our facial bones are the bones that we find in our face. They're the ones that make the framework of our face. And actually, our facial bones is what gives our face its unique appearance. Now, the facial bones have some cavities because we do have some sensory organs like our eyes for sight, our nose and our mouth so that we can taste and we can smell. And then, of course, we have openings for air passages. So that's important that our facial bones are designed in a way that we can have these openings for us to be able to breathe and air to pass through them. We also have jaw bones that secure our teeth. And then there's a lot of places throughout our face where facial muscles are anchored so that we can do things like talk and chew and smile and frown and raise our eyebrows, along with all the different facial movements that we can make. Now, the parts of the skull, we're going to start off today and we're going to talk a little bit about the cranium. So the cranium is this top portion of the skull, and it's made of 8 cranial bones, and it really serves as a helmet. It protects our brain. I tell students, if you've ever seen the game Cranium, it's got the skull open and stuff coming out of the brain. That's because the cranium is open, and that's the name of that structure of the skull. So the very anterior portion of our cranium is made up of the frontal bone. Basically, it's our forehead, but your forehead actually goes back farther than just what we see. It goes under your hairline. And the very, very front part or anterior part is called the frontal squama, which is what we know of as our forehead. Right where your eyebrows are found, there's a thick area of bone that's known as the supraorbital margins, and that's just a special name that's given to that part of the frontal bone. The frontal bone curves in and actually forms the top part of your orbits, or what we know as our eye sockets. And right between your eye sockets, there's a very smooth area. A lot of times we'll push on it when we have a headache. That's known as the glabella. It's a smooth portion between the orbits. There's a lot of nerve endings right there at your glabella. And then right at the very top where your forehead meets your nose, that's known as the frontonasal suture. And we'll see some pictures of these as we move through the PowerPoint. So the parietal bone, there's 2 of them. They're on each side of the head. If you put your hands on the sides of your head and kind of rock it back and forth and go like, oh me, oh my, where you have your hands, that's going to be your parietal bones. And they're rectangular when you look at them, but of course they curve around to form that curvature of the skull. They form the top or superior portion of the skull, as well as the right and left sides or lateral aspects of the skull. The bulk of our cranium is made up of the parietal bones, and we actually find 4 of the largest sutures where these parietal bones meet other bones. So where it meets the frontal bone, that's called the coronal suture. Where they meet each other down the middle, that's the sagittal suture. Where they meet the occipital bone, that's known as the lambdoidal suture. And then where they meet our temporal bone, we know that as the squamous suture. Now, the occipital bone, we've actually learned this region, and we know it is the back of our head. So the occipital bone is the skull's back wall, posterior wall, and base. and it forms what's known as the cranial fossa, which is like this shelving unit so that your brain can sit in there. So your cerebellum just sits inside that occipital bone. At the very base of your skull, you're going to find a great big hole that's given the name foramen magnum. Anytime you see the word foramen, it means hole. So magnum foramen means big hole. And that's where your brainstem actually drops out of your skull and connects with the spinal cord. Your occipital bone also has some little knobs on the side. They're called occipital condyles, and that's what allows you to have the ability to nod your head up and down, as well as rotate it left and right. And then also at the very back of your skull, you may notice you have kind of a little lump on the back of your occipital bone. That is the occipital protuberance. It's just this knob-like projection that's found on the backs of our skull. The temporal bones lie just inferior to the parietal bones. They're right at the temples of your head. The word temporis comes from, or the word temple comes from the Latin word temporis, which means time, because a lot of people begin to form gray hair at that particular area of their hairline. But right there where your temples, sometimes we'll rub them around and around and around when we have a headache or we're aggravated. Those bones are known as the temporal bones, and they're extremely complicated shapes. So because of that, we learn them as regions. Now, these regions will not be on your test, but I just wanted to point them out. If you open and close your lower jaw, you'll feel this movement right around your ear. That is the squamous region. That's where the jawbone connects to the tympanic or to the temporal region. The tympanic region is actually inside your ear. It's the external ear canal. And there's a little attachment where a lot of muscles for our tongue and neck attach. The mastoid region is where our facial nerves, we find some neck muscles, and our sinuses are part of the temporal region. And then the petrous region is your middle and inner ear cavities, and also your jugular vein and carotid arteries, which supply 80% of the blood to your brain, are found in the petrous region. So the sphenoid bone is a butterfly-shaped bone, and it's literally just wedged into the cranial bones. It has a central body and 3 processes. The sphenoid bone is kind of complicated, but when you look at your diagrams that you're coloring, you'll be able to see it because you'll color it a specific color and it's labeled. The ethmoid bone is between the sphenoid and nasal bones. It forms the roof of your nasal cavities. There's little holes so that way your nerves can pass through so that you can smell. And also the very top part of your nasal septum is your ethmoid bone. Throughout the cranium, you'll find these little bones that are kind of isolated. I tell people they're like little islands that accidentally formed. They're known as the vormenium bones, but we call them sutural bones. And it's basically where your bones grew together and formed the sutures. These little islands of bones were formed, or bone clusters. So because of that, no one has the same sutural bones. And I'm going to show them to you on a picture in just a second. So there's several different ways to look at the skull. And if you noticed, you have multiple diagrams of the skull because each view of the skull reveals different bones. In this PowerPoint, you're going to see that the bones are colored a unique color. So if you see this like color teal somewhere, you know that's the parietal bone. Whereas if you see this goldish color, you know that that's the frontal bone. So this particular diagram allows you to see a lateral aspect of the skull. When you're doing your diagrams, be sure to review and look at this picture as you color it. You may want to pause the video right now and go on and start labeling your diagram and coloring your diagram for your upcoming diagram test. This is a posterior view of the skull, and if you notice, you really can't see a whole lot. You see the parietal bones, you see the occipital bones, and then that tan bone right there, that's going to be the temporal bone. So you only see a small little portion of it. But you do see some of your suture lines there, and here's one of those little sutural bones that gets formed. And then, of course, we have to open up the skull. Inside the skull, you're going to see the different bones a different way. So like right here, this is the frontal bone. This is that sphenoid that looks kind of like a butterfly. Then here's the temporal, and then you see the occipital and the parietal. So once again, every time you look at the skull in a different way, you see bones in a different shape. So the facial bones make up our face, and I'm going to show you a picture of it in just a second. But there are 14 facial bones in all. And of course, men and women have different shaped faces, and it's because the skeleton is shaped differently. Men's skeleton tends to be more elongated and angular, where women's are shorter and more rounded. So therefore, we have more of a feminine look, whereas men have a more masculine look to their facial bones. The mandible is our lower jawbone. It's U-shaped. It's the largest and strongest bone in the face. Matter of fact, the mandible is used by a lot of native cultures as a weapon. I know that in the Bible, Samson used a mandible from a donkey, and that's what he used to fight. I spent some time in New Zealand, and the Maori tribes used the mandible of different animals as a weapon. It consists of a chin and two branches that come up by your ears, and those are known as the rami. And there's a very large muscle which opens and closes the jaw by elevating that mandible. And then, of course, we have teeth anchored into the mandible along it as well. Your mandible, when you were a baby, was not fused at your chin. And as you got older, it began to fuse down the middle. So right at the middle of your chin, on the front of your face, there's a little line of fusion that's known as the mandibular symphysis. And then, of course, our teeth have to be able to have sensation. So there's little holes, which is foramina. That's the plural for foramen. Foramina that allows us to be able to run nerves up to our teeth. The maxilla is the upper jaw, and that's what forms basically what we call our face. Our upper teeth are connected to the maxilla. And if you take your tongue and run it across the top of your mouth, you'll notice the top of your mouth is hard until you get back about the last third, and then it gets soft. That hardened part is part of your maxilla. So it forms the hard palate of your mouth, and then it also forms the bridge of your nose. Some other bones that we find in the facial bones, we have the zygomatic bones. That's your cheekbones. The nasal bones form the bridge of your nose. Your lacrimal bones are right on the inside of your eye, and that's where your tear ducts are. And so that's a bone with a little hole that allows the tear ducts to secrete. Your palatine bones, these are palates that are found in your nasal cavities and in your mouth. And then the vomer is actually a cartilage structure. It's your septum that divides your nose in left and right. And we're going to talk about it in just a second. Your eye sockets are a very special structure, but they're not made of their own bone. Instead, you'll see that the orbits or eye sockets are made of kind of a mashup of the frontal, sphenoid, zygomatic, maxilla, palatine, lacrimal, and ethmoid bones. So it's kind of like they all fuse together and form these sockets where your eyes can sit. And there's muscles all throughout that area so that you can move your eyes around. And then, of course, you have glands that allow you to produce tears. One other big cavity that's very important is your nasal cavity, and it's made by bone, but it's also made with a lot of cartilage. Your nasal cavity is divided in half by your septum, that little divider that you see in your nose between the nostrils. If you ever heard of someone having a deviated septum, it's where the septum is closer to the left or right, and that can cause problems for individuals who may have some sinus problems, because what happens is the side that's kind of squished down may not drain like it's supposed to, and it can lead to a lot of sinus infections. Inside your nasal cavity, you find a lot of mucus secreting epithelial tissue, which allows it to be moistened and warm the air, so when you breathe in, it doesn't hurt. So it's not like sharp pains going to your brain whenever you take a deep breath of cold air. So here's a picture of the anterior aspect of the skull. And once again, you'll notice that there are multiple views of the skull. And once again, these colors, this color palette is the same for all of those diagrams as I showed you earlier. So what I would do is I would pause the video here and I would look at my diagrams that I have of the skull, and I would make sure that I color the anterior aspect to match this. Maybe not the colors, but to make sure that you know what each bone is. You'll also notice that some of the bones that I discussed when discussing the cranium, they're also going to be here, like the glabella and the supraorbital foramen, things like that. So that's going to end it for the skull. You have several diagrams of the skull because there's so many different views. If you have any questions, please feel free to email me.